Thank you. Woo. Woo, woo. This is great. I'm so thrilled, as every one of you are, to be here, especially after last year. But I actually had a particularly thrilling, not really thrilling, but scary last year and a half. And I wasn't going to talk about it, but I decided to, because actually NeoLife more than took a part in it. One very understanding, Kendra and the team. I was supposed to show up at the World Team Meeting October of 2019, and I wasn't able to due to this sudden emergency. And what I want to share is a brief story. I went on a bucket list trip. I went with some women that I swim with on a swim team, and my daughter, who's a swimmer, and we went to the tiny Greek islands in the Aegean Sea, and we swam 5 miles a day. That may not sound like that's much fun, but to me, it's a lot of fun. So we did this trip, came back. Precisely 23 days later, upon returning, I started feeling not so well. That pursued and pursued. I felt like I had, I don't even know what, a flu in September. So my method for anything is to go and do a workout, not just one workout, but 3 workouts. And so I swam a swim workout, I rode 40 miles on my bike, and I did a strength training workout. By the afternoon, I was in the emergency room, and I was septic. I almost died. I had kidney failure. Nobody knew what was wrong. Couldn't figure it out. I was shipped via ambulance to a big health center in Sacramento, and an infectious disease doctor took my case, and it took a while, but they figured out that I had leptospirosis, a spirochete organism that invaded my nostrils most likely. I was in the wrong spot of water at the wrong time, and no one else on the trip got sick. I'm so thankful. And, you know, more than anything, I'm so thankful that and grateful and feel blessed that I recovered. I wasn't supposed to. So, really pretty stunning. Thank you. Thanks very much. And NeoLife played a big role because, number one, my husband gave the call, I believe, to Diane saying, she's in the ICU right now. She's not able to do anything, and I wasn't able to for months and months. And Kendra, the whole team, very understanding. And then, of course, NeoLife products. I doubled up. I researched what else should I do, and you'll be hearing from John Miller after me about regenerative nutrition. And it's important then when you have such a severe setback. I lost quite a bit of muscle mass, and anyway, lots of things that happened. So I'm glad I shared that because I feel blessed that I'm here and seeing your great faces. Thanks, that's okay. All right. Kendra, very nicely, thank you, Kendra. When we chatted about the convention, and I knew that the launch was happening, I knew John had a topic, and Kendra, what would you know, what's the topic? You know, I'm used to, here's a slip of paper or an email, talk about this. And she said, you tell me. And I love that. I love that. To me, the cornerstone message of NeoLife, end the trend, everybody say it, end the trend. It drew me in. When John first spoke to me about joining the SAB, and I'm on my 5th year now, I like that. That mission corner statement made a big difference to me, because that's what it's about, is helping people one by one at all different ages to help them stay on the path to healthy life and chronic-related lifestyle diseases. The number one chronic lifestyle-related disease is heart disease and related vascular diseases. So I thank Kendra for giving me the opportunity. It fits beautifully with what we're learning yesterday and today. So as far as what are the stats, you might think, this is really just for older people. I really don't want to listen to this, or wait until I get chest pain, and you know, my older members of the family are the ones that should be listening to this. Not the case at all. It's the number one cause of death worldwide for men and women. And I'm going to tell you something bold. With the exception of the few newborns that I have seen in the room, and that's not you or you or you. There are a few of them, and then there are a couple of toddlers, and maybe I've seen a couple under the age of 10. With the exception of those wonderful, cute, adorable little individuals, everyone else in here has some aspect of vascular disease that has started. You can't feel it, and I'm going to show you how it works. You feel it when it's gone on for 20, 30 years and you have a heart attack. That's when you feel it, when it's, I don't want to say it's too late, but it potentially could be too late. And it's not just a small cause of death. 1/3 of all deaths worldwide are from heart disease, and in fact, this afflicts poorer and lower economic communities more readily. So what I want to do is tell a story about heart disease, about how it all happens. We hear words like good cholesterol, bad cholesterol, platelets, what are those? You know, red wine's good for you, all sorts of things. I want to give you a foundation of how could you describe heart disease to your NeoLife family, and then it makes sense why you want to reduce saturated fat, why you want to eat whole foods, why you want polyphenols in your diet, why antioxidants are so, it's all going to fit together. But you need the story, and you need to understand the story. And I'm going to be real frank with you, physicians have a hard time telling the story, because there are a lot of players, lipoproteins, LDL, HDL, what? What are those things? Well, we're going to go through it, and I feel very confident you're going to do great. So we're going to look at how does heart disease develop. We'll take a close look at why might I develop heart disease in my 70s, but another woman doesn't. Well, they're called risk factors that predispose you to cardiovascular disease. We'll look at those related to diet, and those that have a negative impact on heart health, and those that are positive. And finally, what kind of dietary recommendations do we want to take, follow? What can we do now? It's like the Challenge Champions. This is a now thing. This isn't when I get older. We're all going to get older, hopefully, and we want to do it in style and good health. Now, I love this frame because it's this older gentleman, somebody's uncle, grandpa, who knows, maybe it's you, and you just say, oh, God, you know, that's who I think should care about heart disease. No. I should have had a baby in there, in that picture. But it's confusing. Does that mean I can't eat donuts and I have to live off carrots? Absolutely not. We need to figure out an easy way to understand the role that diet plays and understand why some of those foods are not ones that should be make a repeat appearance on your plate. So this is a cross-section. If I were to take a blood vessel called an artery, this is like cutting a piece of salami, this is a cross-section. But it is a artery from your heart, so we call it a coronary artery. Your heart is a muscle. That muscle beats and pumps blood, and blood carries oxygen. It carries nutrients, vitamins, minerals, protein, carbohydrate, fat. It's your life force. And that heart has got to work pretty hard pumping. So that heart also needs oxygen, nutrients, everything else your leg muscle needs. So it's a muscle, and it needs its own blood supply. The heart muscle needs its own blood supply. So we've done a cross-section of a coronary artery, and there it is, nice and clean and open, and that's what's in a newborn that we've seen walking around, not walking around, walking around with mom or dad or whoever. If we were able to look inside, maybe in a 3-year-old for sure, 5-year-old, we believe it's starting somewhere after the age of 5. And what do I mean by starting? An injury occurs in the endothelium, the lining, the blood vessel lining. I want you to think of your blood vessels as roadways, and there's traffic inside of you. There are cars, there are trucks bringing nutrients, and there are buses. I'm going to show you more about the buses, but just think of it as you've got a busy set of freeways, expressways, boulevards, streets, and cul-de-sacs in your body. Well, a carrier of fat called low-density lipoprotein, LDL, is actually a yellow bus, and it drives through your blood vessels. It's supposed to. Its job is to take cholesterol to cells. Cholesterol is not a bad character. I'll actually introduce you to what cholesterol looks like. And what happens, though, is something's amiss with your artery lining. It's been injured. It's been inflamed. Why? Because a person's obese. Why? Because somebody's smoking. Somebody has a poor diet. Genetics. And that LDL basically crashes into the artery wall. Cholesterol comes out. It gets calcified. Plaque builds up. The body starts to treat it like a true injury. Something's wrong here. I don't like this. I'm going to send my platelets, my blood cells, or a type of blood substance that's just going to clump around that injury. So now what's happened to the space that my blood flows through? What's happened to it, people? It's narrow. So you go outside Monday morning and you're going to shovel some snow, and you have a sudden demand of oxygen throughout your body, and your heart goes, okay, I'm with it, I'm with it. But you can't get the oxygen to the heart, and you have a heart attack. Or a chunk breaks off inside your blood vessel, and it moves down to another narrowed opening and blocks it there. It happens all the time. It can lead to stroke, and in some men, it causes erectile dysfunction. So this has some far-reaching effects when we talk about atherosclerosis. Now, what I'm going to do before I show you the fun cartoons is I want to show you a diagram that people learn in college or physicians learn, and I want to show you lipoprotein transport. We're going to talk about LDLs, HDLs, all that business. The diagram I'm going to go through step by step and take a picture of it. Let me start by saying somebody won a Nobel Prize for medicine for figuring this out. Okay, so this isn't something I expect you to go, oh, that's so obvious. We got to see this, and then I'll show you cartoons that'll help immensely. And by the way, they're the same cartoons I show to physicians, who then say, oh, I got this now. So here we have the inside of you. We have the digestive tract, and we have accessory organs that include the liver. I am going to eat one of my favorite foods. I hope you can read it up there. Cream cheese. Do we have any cream cheese lovers? Oh, my gosh, it's a food that's going with me when I leave this world. It just is. It has to. So cream cheese, sorry to say, is 92% fat. And another word for fat is triglyceride. Because cream cheese is made from cow's milk cream, it also has cholesterol. Cholesterol is a fatty, waxy substance. Not saying to do this now, but stick your finger in your ear, dig a little bit, go, oh, here's some earwax. That's exactly what cholesterol is like. I didn't just do that. I just pretended I did that. I just thought that may have looked gross. So it's a fatty, waxy substance. Okay, if I were to take cream cheese and put it in a jug of water with a lid on it and shake it, and earwax, and shake it, would they dissolve? Why not? They're fatty substances. Fat and water don't mix. So our big job is to make that cream cheese that has triglyceride and cholesterol soluble in the bloodstream. So what we do is, there's a bit of a process in the intestinal tract, and we take cholesterol from the cream cheese and the triglyceride, we package it up into something called a chylomicron. This chylomicron comes out of your intestinal tract indirectly, is driving through, it's a big bus, it's driving through, and it is the transport form of fat and cholesterol from a meal. If anybody ate breakfast this morning, and that breakfast contained fat, so if you had a bagel and cream cheese, or if you had some eggs, which has some cholesterol and may have some fat, depending on how it was fixed, you have a chylomicron floating around from your morning meal. If you have eaten nothing since yesterday, you don't have any chylomicrons floating in you. But not to worry, here's what happens. Chylomicron's job is to drive over to muscle cells and fat cells and drop off triglyceride. Here's some fat muscles. You're going to go running. Let me tell you, Chelsea's muscle cells, they want the fat. It doesn't go to her fat cells. In regular routine exercisers, that's the way the body directs it. Okay, here, I know it's going to get used. You're sitting around, you're eating late at night, it's going to go to your fat cells, right? That's the way it's programmed to go. Well, this bus isn't going to stay forever in your bloodstream. After about 11, 12 hours, it goes to what I call bus headquarters, the liver, and anything that was left was repackaged, and you also make new fat, and you make cholesterol. Your body has the ability to do that, and it pumps it out as a new lipoprotein called VLDL, very low density lipoprotein. That's a more compact, it's not dinky, but it looks a little bit different, right? Okay, so what's its job? It's the same as chylomicron. It is going to take triglyceride, that's the only passenger that's going to get off the bus, and it's going to go to fat and muscle cells depending on your activity. If you're an active exerciser, it most likely will go to muscle cells. If you're in the process of gaining weight or not losing weight, some of it's going to go to your fat cells. It can be called upon later for fuel, but you have to be needing those calories. In the process of this lipoprotein getting rid of its passengers, it turns into a new one called LDL. Anybody hear of that? Okay, this is low density lipoprotein. I just let go of a lot of triglycerides, so who's staying on the LDL bus? Cholesterol. There's more cholesterol than there is triglyceride. The job of this lipoprotein, which is a good job, it's not a bad character. So I don't really like it when it's called bad cholesterol, but I'll show you how it can go bad. So LDL's job is to drop cholesterol off to cells. What for? Why does a cell need cholesterol? It's involved in cell membrane structure. It's involved in telling what cells what to do. It's involved in making vitamin D. We all need that. And it's involved in, you take cholesterol and you convert it into sex hormones. Are those bad? Are you thinking about it? People, come on. So cholesterol's good stuff. This LDL bus, lipoprotein's going to go to the liver, and it actually, indirectly, there's a new lipoprotein that comes out, and it's called HDL, high density lipoprotein. Nice and compact, it's heavy. It's heavy because it has more protein on the outside, which makes it more soluble in the bloodstream, and its passengers are both triglyceride and cholesterol, but it has a really good job. It actually takes cholesterol from dead and dying cells and cholesterol that's fallen off of an LDL. That's why we call it the good carrier, or the good cholesterol. Now, how do I get rid of cholesterol from my body? Well, you make a compound called bile. It's involved in digestion. And bile gets squirted into the intestinal tract and helps solubilize. It's actually soap, and it helps you digest fats. There's a way I can get rid of cholesterol in my body if I don't absorb bile. So hold that thought when we talk about fiber. That's where that comes in. All right, the heck with that diagram, right? That was kind of a lot, but congratulations, you did it. But here it is in different form. Your fat and cholesterol movement in your body is just like bus transportation. Remember, there are cars and trucks, but we're only talking about moving fat and cholesterol in your bloodstream. And we're going to really kind of put chylomicrons aside. We have VLDL, LDL, and HDL. Let's meet them up close. Here are 3 buses. The biggest bus is VLDL, and the passengers on all 3 buses, they carry triglyceride and cholesterol. Why must triglyceride and cholesterol be inside of a bus and not just walking on the roadway? They're not soluble in the bloodstream. It can't happen. They have to be getting a ride. So the VLDL carries triglyceride to cells. Its job is that, but it has both cholesterol and triglyceride. Look, triglyceride, this little blue dude, he's fine. He's not bad. What do we need him or her for? Energy. It's a very important source of energy. Go to fat or muscle cells. LDL, it ends up being cholesterol rich, and it takes cholesterol, and notice cholesterol has some luggage because we're going to have a mishap happen, and I don't want you to think that that adorable cholesterol got hurt in our mishap. But anyway, this cholesterol, you'll see in a second, is carrying some luggage. The job of LDL is what? You can read it. Deliver cholesterol to cells. Is that a good thing? Absolutely. Absolutely. We haven't gotten anything bad yet. Okay, HDL. It is a smaller, look at that, more compact bus. It picks up cholesterol that's falling out of dead and dying cells or came off of a lipoprotein, LDL, and it gets picked up. So let's see him in action. Here we go. Bus driver goes over, stops at fat or muscle cells, opens the door, only triglyceride gets off. Who's staying on the bus? Cholesterol. Okay, LDL. Drives around. That bus has a lot of cholesterol in it. Who's getting off the bus? Only cholesterol with its luggage. Now, notice that LDL stops at bus stops. It's got to stop where it's wanted. It's called a cell receptor. Some people have a defect and their cell receptors don't work very well. In fact, somebody came along and graffitied the bus stop sign. So the bus driver's looking around, I don't know where to take this. And it ends up causing a problem. Some people with a genetic defect for clearing LDLs end up dying of a heart attack at age 21 because they have so much built up. You can have a variation of this defect and you end up with heart disease in your 40s. So all sorts of things are possible. All right, last one, HDL, really nice bus driver, offering a ride. Hey, do you want to ride? And I'll take you back to the liver, because remember, the liver's a way that we can get rid of cholesterol via bile. And I'll, again, show you how to do it. But sometimes things don't go very well. That bus driver gets oxidized. Those little triglyceride and cholesterol kids are singing 99 bottles of beer on the wall. Well, probably something different. And he's getting irritated. But look, they're happy people, but now they're petrified because the roadway maybe is bumpy and degrading, or the LDL itself doesn't have the right protection, such as, I haven't shown it here, but there's a couple of vitamin E's on the bus, about 2 or 3 for every LDL. Why? It's an antioxidant that keeps the fat protected. And there are many other fat-soluble compounds that are there if you're having a good diet, if you're getting what you need. So when this happens, he or she, bus driver, can't help but to crash. It's not good, but remember, what was cholesterol carrying? Luggage. Okay, so nobody got hurt in this drawing. And we have an accident. So we have cholesterol luggage strewn on the roadways. And, you know, you might think, well, that hasn't happened to me. Oh, yeah, it has. You can't feel it at all. You can't feel it at all. In fact, it's happened thousands and thousands of times. And it's there, and you just have this cholesterol buildup going on. Now, anytime that you are involved on the roadway and you drive by, whoa, there was an accident, what do? You slow down, and what do? Look, and who said it? You rubberneck. What do rubberneckers do to an accident scene? How do they help anything? They don't. They clog things up, and that's what platelets are. They're little rubberneckers. They're little rubberneckers, and they end up clogging things up. They go, what's going on? What's going on? Oh, an injury, and they just sort of clump around it. They're so cute, you want to take them home for lunch. But they're just doing their job to try to help protect you from this injury. So what happens is that over time, this repeat crashing of LDL infiltrating artery walls builds up. There's an immune response to it as well, and I'm simplifying it obviously, but the cholesterol ends up getting tucked into that endothelium, and we end up with this. We end up with narrowed arteries, platelets thinking it's a real true injury, clotting the blood. And in fact, when you're told to take a baby aspirin, it actually tells the platelets, hey, break it up. I'm going to tell you guys all to leave the scene. It's like a CHP officer. Get out of here. No rubbernecking. And that helps ease the blood flow. So it's an important step. So the question is, why is it that the number of LDL buses may go up? And this is one of the major risk factors. If you have blood work done and you have a high number of LDL buses, and then we say, oh, you have a lot of the bad cholesterol. Actually, what happens is that cholesterol is not bad. It's just that you have something going on that's modified bus transportation. You've probably got bumpy roads, not enough protection, angry bus drivers. So there's a lot more. Don't blame cholesterol. It's really a good character. It's just who's driving it. So there are all these different factors, and this is a lifetime. So 10-year-olds, 15-year-olds, 20-year-olds, everybody is developing this silently, until you have enough blockage that you make an effort to do something quick, try to catch a plane, and you have chest pain. Or for a woman, same thing, but she feels like she has the flu. Well, what are the risk factors? Why might one person develop heart disease and another one not? These top three: smoking, high blood pressure, and hypercholesterolemia. Hyper means high cholesterol. Emia means blood. Okay, so you have high levels of cholesterol in your blood. And when I say high levels of cholesterol, I mean all of your buses I've sampled, and I'm counting up VLDLs, LDLs, and HDLs. And I add them all together, and I tell you your total cholesterol. That puts you at risk. Hypertension, why high blood pressure? It irritates your arteries. It makes your roadways not very smooth. Smoking causes inflammation. It makes the bus driver angry. It also ruins the roadways. Dietary factors we're going to go over. A high saturated fat intake, for example, is very problematic. Eating a lot of fruits and vegetables, what do you think? Is that good? Absolutely, because you're getting antioxidants and other compounds. Diabetes, we talked about this with glucose balance. Elevated blood sugar irritates the lining. And so that bus driver is like, whoa, whoa, this road is terrible, and crashes. Also, you can't help your genetics, but you may have spray-painted bus signs. The driver can't see them. As you get older, it's really an age-related disease as well, so the older you are, the greater your risk. And the obesity story, and I'll complement this to me is like the #1 reason the challenge champions, when you modify your health risk, that is, you lower your body mass index and you lower abdominal body fat, you make it so those blood vessels have much less irritation, and you lower your risk for heart disease. Guys, sorry, you're at higher risk all the way until you're roughly, when a woman turns around 55, she then has a higher risk and can equal yours. But because the fact you don't have a lot of estrogen, you might be happy about that, it ends up that it impacts the way lipoproteins transport and cholesterol production. And finally, inactivity. When you don't exercise, you have bus traffic jams. It's that simple. They don't get cleared out, they don't know where to go, and they end up crashing. So what are the risk factors that are modifiable by what you eat? And I want you to take a look at these. It is in your control to take charge of your heart health. Don't blame it on your parents. That's over with. I've been blaming a lot of things on my parents. I don't know why, but I do. So look at these things when we talk about high blood pressure, high blood cholesterol, metabolic syndrome, which I'm going to focus on in a second. You have so many opportunities to modify your risk. And the beauty of it is you modify one, like obesity, you end up changing many, if not most, of the others. So metabolic syndrome, have you heard of this? Okay, so it's characterized by two main factors: having abdominal obesity, so a waist measurement greater than 35 inches for women, 41 or 40 for men. So you got to do it right at the belly button. You got to take a measurement, face what it is. because that body fat irritates your artery walls. It's that simple. And if you're not utilizing, your insulin is not very effective. You have what's called insulin resistance. You get your blood work done, you're fasted, it's over 100. You are on your way, more irritation to your arteries. High blood pressure, as well as elevated triglycerides and low levels of HDL. Low levels. So you don't have many of the good buses going around. That's a problem. Metabolic syndrome from abdominal obesity is known to cause that. So let's look at blood cholesterol level. If I want to measure yours, remember, I am measuring all of your cholesterol in all those different buses. If your level's below 200, your cardiovascular death rate risk is low. Over 200, and the units are milligram per deciliter, the units your physician would give it to you in. Once you're over 100, it gets bad. But it gets even worse once you're over 300. I had the great opportunity to work with professional teams. San Francisco 49ers was one recently, and I worked with a, can't say who, a star athlete on that. Well, there are many star athletes. And healthy, fit, everything. His blood cholesterol was 325. Was it because he wasn't exercising? Was it, you go down the list, he's got genetic risk. He probably has bus stops that are defective. Somebody graffitied them, genetic problems. But he did have to modify his diet. If you have had your blood cholesterol measured, here are classifications. So if you're a little bit over 200, not so bad. If you're a lot over it, problem. And usually your physician puts you on statins or other medications that tell your liver, stop making cholesterol, just slow it down. Slow it down so we don't have so many LDL buses. That's an approach, but diet is also a good one. You want to ask right away, can you show me my LDL cholesterol and can you show me my HDL cholesterol? Why do I want to know those? LDL is the carrier of cholesterol that has the likelihood of crashing into my artery walls. The higher that is, that's not good. And HDL, if it's low, that also is not good. So I want to make sure that I get that down and know all about it. So let's take a look at some of the dietary connections. I'm going to go through fat. I'm going to talk about cholesterol intake, a couple of other things, and then get into specifics and finish up. So fat intake is a big deal. Around the world, if we look at how much fat we eat in the US, we eat that's being consumed in England, high-fat diets, high risk for cardiovascular disease. People eating traditional diets in Egypt, China, Korea, low intake of fat, low risk of heart disease. However, there are exceptions. There are some African tribes, Maasai tribe, where the indigenous diet is eating meat, drinking blood. Potentially a lot of fat and a lot of cholesterol in the diet, zero heart disease. So different genetics, different lifestyle, and Eskimos eat a very high-fat diet, a lot of seal blubber. So what about total fat? What do you need to do? Keep it down to roughly less than a third of your calories from fat. But we have to look at type of fat. Saturated fat, I have pictured here as butter, lard that comes from animals, hydrogenated vegetable fat, which is saturated fat, and tropical oils. When you eat a lot of those, that's your major fat source, it makes blood cholesterol go up. I'm not saying that saturated fat is cholesterol. They're not. It's that when you eat saturated fat, it makes bus transportation mucked up. It just doesn't work as well. And so you end up with more LDL, and you have a greater risk for heart disease. Trans fats are a type of fat that's formed, sorry about this, formed when you hydrogenate. Have you heard about trans fats before? Okay, tell me a food source. Margarine, very good. So what happens is that when an oil is hydrogenated, it forms an unusual type of fat structure called trans fats. And what the body looks at and goes, well, I think that's saturated fat. And it ends up being very detrimental to heart health. So you're supposed to avoid that altogether. Monounsaturated fats are the good ones. They lower blood cholesterol, they lower LDL, but they don't affect HDL. Great. So cook with these. Cook with olive oil, avocado oil, canola oil. Those are the types that you want to have in your diet. Polyunsaturated fats used to get a lot of good press, like safflower oil and corn oil. We want to keep that around 10% of the total calories, because while they lower, if you replace your butter with some of these polys, it can also lower HDLs. Do we want our HDLs to go down? No. So just be modest on your intake of this. But what about these highly polyunsaturated fats from seafood? They're longer chain, they're very liquidy. Of course, a fish lives in cold water. They need different kinds of fats on their body. And in fact, the connection with lowering LDL levels, lowering triglyceride levels with seafood is very strong. And in fact, the US Department of Agriculture, the American Heart Association states 2 servings, 4-ounce servings of fatty fish per week. Guess how many people do that? Very few, and we have to look at different age groups, and the data's there, but very few people do that. And what we can be quite thankful for is NeoLife Salmon Oil Plus. Yay! And this product, unlike other products, is not just 1 or 2. I have, oh, thanks, more. Oh, that's something different. What is this? Oh, thank you. You're amazing, Lloyd. Okay, well, let's test it. I like that. That helps. Thank you. Okay, I won't put it on the speaker, folks back there. I don't want to hurt it. All right, the difference with Salmon Oil Plus is we have a profile of 8 of the most nutritionally significant omega-3s. You go to another omega-3 supplement on the market, and it's just usually 1 or 2, EPA or DHA. It's very pure, sustainably sourced, and has clinically been proven to lower triglyceride, beneficial for heart health. Can I eat cholesterol? Is it okay? What's your opinion now? Is cholesterol a bad guy? No, it's not. But many high cholesterol foods, they're all animal products. What do you think they're high in? Fat, saturated fat. So when you say, oh, I don't want to eat eggs, look at who they're hanging out with. We have Bacon Bart and Sammy sausage. They're really high in saturated fat. There is no connection between egg consumption and heart disease risk. Eggs are rich in many important nutrients, choline in particular. What about fiber? Well, heart health benefits of fiber are tremendous. Remember, fiber is not digestible. There are 2 types of fiber. Insoluble, bulks up, helps relieve constipation. Soluble fiber forms a gel, and it slows down the emptying of contents from your stomach. It helps lower blood cholesterol, and it's been shown to help moderate blood sugar response to a meal, very helpful for type 2 diabetes. It helps control your appetite, and we want to aim for 14 grams of fiber for every 1,000 calories we eat. Less than 7% of the adult population meets that requirement. Less than 7. Staggering. These are the things that keep me up at night. How can we change this? Well, soluble fiber superstars, I want to show you these. We have black beans, good source with 5, apples. There are many others. Citrus fruit, you know, the white fuzzy stuff, that's soluble fiber. And I just had to put in SpongeBob somewhere. I really like SpongeBob. And it's really chia seeds. That was a chia pet, by the way. Chia seeds are a really good source of soluble fiber, as is, last one, oats are one of the best. one of the best soluble fiber sources. Well, guess what? Let's take a look at how fiber works. Oh, we're back to this diagram. Don't get tense. I just want to show you one thing. I'm going to eat my bagel and cream cheese, but I'm going to have some all-natural NeoLife fiber with it, or I'm going to have a bowl of oatmeal. What happens? How can fiber that's not digestible help me lower my blood cholesterol? A bizarre thought, right? Doesn't that kind of stump? It used to stump me. Well, I'm going to indicate that fiber with brown in there. So there it is with the cholesterol and the fat, and it's like sticky Velcro. It's going to bind to it. So when it goes down into the small intestine and tries to get absorbed, it won't be. And the bile also sticks to it. So very little gets in your body, and it goes out in your stool. So something that never gets inside of you in terms of in your bloodstream can help lower something in your bloodstream. That's an important thing to tell a story about, because a lot of people don't believe it, but it works quite well. All natural fiber, NeoLife's product is excellent, 6 grams of fiber per serving. It has oat fiber. Oat's one of the richest sources of soluble fiber. Multiple ways to use it, in recipes, in your drinks, in all sorts of ways, and it's a vegetarian formula. So to look at, okay, now what do we need to do? Here are our dietary recommendations. As you guessed it, change your fat, type of fat, watch your dietary cholesterol because of who it hangs out with. And then we didn't talk much about sodium and hypertension, but it's there. So I think it's important at this point to finish up with, what's all this story about garlic, red wine, chocolate? What could they possibly be doing to lower a person's risk for heart disease? Well, color compounds exist in red grapes, as well as an infinite number of fruits and vegetables. There are particular ones in red grapes, and they get into red wine. I want to say there's nothing special about red wine. It could be grape juice as well. It doesn't have to have the alcohol. 1 5-ounce glass a day may lower heart disease risk. And I can't tell you how many times I go to the grocery store and someone sees me and they've got multiple bottles of wine in their cart. And they always have to tell me, oh, I only drink it for the heart benefits. I really don't care. You do you. It's not my business. But what the compound called resveratrol does is it comes in like that CHP officer and says, hey, rubberneckers, there's nothing here for you to see. It tells platelets to not aggregate, to go away. So it inhibits platelet aggregation. I can't emphasize enough the importance of whole food in combating and beating heart disease. NeoLife does it best. Tray is an amazing product, absolutely stunning product. Pomegranate juice, acai, green tea, and the influx, the whole berry collection. We have a tremendous profile of polyphenols. These are like resveratrol, it's on the list. And in fact, ounce for ounce, Tray is providing a lot more than an ounce of spinach, for example, or altogether an ounce of pomegranate and so on. It's really power-packed with the important thing to think about is the synergy. There's no one phytonutrient or polyphenol or antioxidant, pick the word, that's going to do it all. You want a balance because they sit in different parts of the cell, and a good example of that is with Phyto Defense, another outstanding product. You get the phytonutrient protection of 6 servings of optimal fruits and vegetables. And what I was so impressed with, and I thank John Miller for bringing me on board, is he sent me quite a bit of research from USDA and other researchers that actually tested the carotenoid complex to look at antioxidant capacity increase close to 50% with the use of this. That's what you want to know when you take that and then trying to translate that to, I have better antioxidant protection. My bus driver's not going to get angry and crash. My roadways are going to stay smooth. So you have a way to look at it with that analogy. And then CoQ10. There are many products that NeoLife has, but CoQ10 is kind of vitamin Q in a way. It's not determined yet as being a vitamin because we have the ability to make our own. It's involved in cellular energy for you to get energy out of your oxidizing protein and carbohydrates and fats. It also serves an antioxidant role. As you get older, roughly around the age of 50, your ability to make your own CoQ10 goes down. And low CoQ10 status is associated very strongly with metabolic syndrome, with increased risk for cardiovascular disease. So this isn't unlike other products, this is more than just CoQ10. It's plant-derived, you have phytolipids, sterols, antioxidants providing additional benefit. So that's just a smattering of the many different products that NeoLife has. Glucose balance, magnesium. I didn't get a chance, and I'm already over, on garlic. I'm sure you've heard the power of garlic. Okay, well, the garlic alum product is amazing, and it used to be that people would just eat, the research shows, at least 2 big globes of garlic every day can help make your bus driver happy and protect your artery walls. Guess what? You're not going to have any friends. So this is much more agreeable way to do it. So lots there. So I hope, since I've gone over, I apologize, but I'm so excited about giving you the information that you can tell the story about reducing your risk for heart disease starting early in life and end the trend of chronic lifestyle-related diseases. Thank you. Thank you very much.